Hi everyone, it's Connor here from Durham Hearing Specialists. I hope you're doing well and welcome to another video. Thank you very much for watching. Today we've got quite a nice case actually. You can see here in the first ear, it's we've got quite tough wax, very resilient to suction, very dry. And this is an ear which the patient had not treated with olive oil. They had treated their opposite ear, their other ear. So what we're going to see is the difference that olive oil drops make when you're having earwax removed, and we'll see just how effective it is. So in this first ear, we've got quite a job on our hands, and we're going to use a few different tools to get this wax out. Now there, where the arrow is, we've got a nice little gap, and you know, it's like when we have a big enough gap where we can stick a hook into, it's almost like a visceral reaction now. I immediately think hook, 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 hook. Like the crocodile from Peter Pan, you might say. So we've got a hook, put it through the gap. I'm just widening it up at the moment. And the fantastic thing about these tools is that if you've got a gap, you can shove the hook right in, turn it and drag the wax out. Now, this particular hook, as you can see, it's made of metal. It's a bulbed St. Bart's hook, fairly unusual. I featured this in a previous video. And in that video, I was a little bit derogatory about the tool. Basically, I thought it was rubbish. I thought it was far too big to be used in any particular application, and you know, it needed to be downsized. However, I have had an opportunity to use it more and more and more, and you know, getting used to the size of it, it just needs a little bit more. You just need a little bit more practice to use it effectively. So I still think it needs to be smaller. Having said that, it does have its uses, and the main use is that when you use the bulbed hook, you know, it doesn't just kind of drag through the wax and then you have to restart. You know, a lot of debris actually does wrap around the bulb, which is fairly useful. So Chef Med, if you're watching, thank you very much. This was a very useful tool. So again, going in again with the suction, and you can see now just how dry it is really. So the hook has kind of dislodged everything and well, created a bit of a mess, but it has now paved the way for a Jobson horn, so we can now kind of get this, you know, scooping action going, and you know, scoop it off the sides, and then try to sort of drag it forwards. Now, after removing this initial layer, we can actually discover that the ear is not totally blocked, so there is a gap through to the eardrum, which I'll mark with another arrow just in a moment. That's possibly, so there's a suggestion of an eardrum just back there. But this is possibly why the patient didn't apply olive oil to this ear, because they didn't, you know, they didn't feel like there was a hearing loss there, because there's a tiny gap through to the eardrum just there. So we can see that greyish material, see some dilated blood vessels there. So that's possibly why they didn't prepare for removal in this ear. Now the other ear looks completely different, it looks all gungy and oily. But again, not a problem, because we can you know, just with patience, we can leverage this wax out. So again, going in with the hook. Now, you know, going in deep with the hook is always a bit of a risk, particularly if the vision isn't good, you know, particularly if it's a bit dark in the background. And the reason is that in the last third, or the last 2/3 of the ear canal, excuse me, is very sensitive. So it's mainly that's what we call the bony portion of the ear canal. So you can imagine if you have a big bulbed hook kind of knocking around in that area, you know, it can be very uncomfortable, and you know, God forbid, if the patient jumps, flinches, moves in a weird way, then you know, there's a risk that the hook could knock against something and hurt quite a bit. So again, going in with the Jobson horn again, and now we can actually start to drag out the final piece here. So the hook has kind of, again, brought everything forward, and you can see just the consistency of this wax, how kind of viscous it is. It's very sticky, so almost like kind of plaster. Or better yet, sort of Play-Doh or chewing gum, maybe, something like that. But now I can get the Jobson horn right in there and finally bring home this rather hard chunk of wax. And you won't be able to tell just by watching, but I was applying quite a bit of pressure at this point. So in using the hook, probably one of the downsides that in this particular case was that I had, in dragging the wax out, I ended up kind of smearing it on along the ear canal. Which made it kind of stick. So again, I'm having to apply quite a bit of downward pressure on the ear, but again, you know, in this particular portion of the ear canal, it's all cartilage. You know, it's very flexible, it's not going to hurt. nor is it going to cause trauma really to the skin or anything like that. So as you can see how flexible and springy it is. So I'm not too worried about being slightly rough with it. And what I'll do is I'll lay all this out on a tissue paper so you can see. So just wiping the endoscope, going back in. And now we can actually bring it home. So we're going to go around the back. And at this point, I probably could have used a Formby scoop actually, but again, I'd already got the Jobson horn out and it was doing a fairly good job anyway. So if you're interested in learning about what a Formby scoop is for and what it looks like, I'll link it down in the description below. And if you actually, what would be very useful is if you want to know what a regular hook looks like, so an unbulbed hook, basically a normal one, and you want to see that kind of downside where the hook kind of drags through the racks, I'll also link that below in the description so you can see how a regular hook works. So the regular hook just works exactly the same. You go behind, you find a gap or an opportunity, you go behind the wax and pull. But because regular hooks don't have that bulb on the end, they just kind of drag through the earwax mass. So you end up with a dirty hook rather than pulling out what you wanted to pull out. So here we have the sort of final scoop. You can see there's lots of hair entwined in it as well. Going back in, fairly clear ear canal. So lovely looking eardrum there. Again, a little bit vascular, as well as the ear canal actually. You can see it's quite vascular. You've got dilated blood vessels there. So you could say that it's erythematic or erythematous. And that's because that just means redness, essentially. So, and that's because red blood cells are called erythrocytes. So erythema, erythematous, erythrocytes, as you get the idea, that's the sort of terminology behind it. So, but again, not concerning at all. Lovely looking eardrum there, nice and shiny and grey. And at this point, we're just getting rid of this remaining wax and dead skin here. So the idea is we want to leave a nice smearing of wax around the outside of the canal. And we've managed to achieve that actually, which is quite nice. Just cleaning up here. Again, dead skin, less preferable. Wax is preferable to leave behind. So just a little bit down here. And again, the patient was very comfortable during this procedure, so I was fairly confident just to go the extra mile really. So there we go. And there should be a shot of the tank as well. Oh, okay, so here we have the second ear. Massive difference. I mean, this isn't going to take very long at all. You can see how sort of, I wanted to say gelatinous, sort of oily the wax is, how moist it is. And you can see even with dead skin, like this long trail of dead skin here, you see how easy that unravels and just pulls out. So, and again, olive oil also, the added benefit is that it makes wax removal much more comfortable for the patient. Now this particular patient was very comfortable even when I was digging around with the Jobson horn, but it just lubricates the canals and means that whatever I pull out isn't going to scrape, isn't going to cause much friction at all. There we go. And look at that, job done. So the amount of olive oil that they applied, it was probably about 4 or 5 days. I can't exactly remember, but certainly less than a week's worth of olive oil in this particular ear. So if they had applied it in the other ear, probably not even worth posting because it would have been so quick. But there we go, lovely looking eardrum on that side. There is the hook and the Jobson horn with all of the debris that we removed. So it's, now that I look at it on the tissue paper, it is mostly dead skin really, just very tightly packed dead skin. And then the hook and the Jobson horn there. So you can see the size difference is quite interesting. You can see even though the bulbed hook is significantly larger than a normal hook, you can still go a lot deeper with the hook than you can with the Jobson horn. There's a shot of the tank, and again, most of what's in here is from the ear that's been treated with olive oil. So there we go. Hope you found this video interesting. I thought it was very interesting just to get a direct comparison. Same patient, same wax really, same genetics, but obviously the oiled ear was just phenomenally easier. So there we go. Thank you very much for watching, liking and subscribing. I will see you on the next video.